invite Rakhi to come and tell us about keeping pace with advancing technology and training.
Good morning, everyone. So my topic today is keeping pace with advancing technology and training. And as usual, technology glitches.
So can I ask one more question, sir?
Okay.
No problem. We're talking about EBI only.
Yeah.
Sir, can I ask one more pertinent
yeah.
question, sir? Sir, there was this, we are from Bihar, so the Soto Bihar is established at IGIMS and it's working as of the location is there as of now. So what had happened? Can I?
Yeah, go ahead.
So what had happened that is once one of the people who were counsel for eye donation agreed to a whole body donation suddenly. Okay, now in our hospital there's no provision for a whole body donation. So when I tried to contact Soto, so how this could be expedited or whatever, what could be done about it. So they wanted that all the records, that medical records of the patient should be WhatsApped to the Soto person. I said, these are confidential records of the hospital, and it's a government hospital. So how can we WhatsApp it to you? He said, no, it's a done thing. We do it in Delhi. But I said, no, this is Bihar. So without, we cannot do it. So exactly, sir, what are the legalities of it? And really, can it be done? Can this be done, actually?
It's huge gray areas over there.
Yeah.
Because these people who are in power just make their own rules. There's nothing written anywhere.
Okay.
And then they simply deny you permission because you've not complied with their bizarre requests.
True.
So
sir.
it is a bizarre request, but then I think you need to comply with that if you want to get your work done. Send the hospital records, and you have it on the Soto person asked for it, who is a legal functionary. Yeah.
Okay, he's a legal functionary. So
Yeah.
it wouldn't be illegal to be sending.
It's not
requests to
illegal.
him.
No, it's not. You're
Okay.
sending it to Soto person. It's not to a private person.
So are eye counselors going to this is a one-time thing that has happened.
Exactly.
Sir. Counseling
It
for
won't be-
eye
it's
donation,
quite rare. It's
agreeing
quite
to
rare.
the whole body donation.
It's quite rare, but go ahead and comply.
Okay,
Yeah.
thank you, sir.
So good morning again. My topic is keeping pace with advancing technology and training. And now the buzzword these days is artificial intelligence, chat GPT, everything going on, technical advancements, etc., etc. I also tried to use some of the AI in making my presentation just to test whether this works or not. So I'll talk about how can we stay updated on technological advancements. As an eye banker, corneal surgeons, as a fraternity, we need to always be updated on what's happening in the world. So we need to regularly monitor and stay informed about the latest technologies, techniques, and equipments used in eye banking. This includes advancement in corneal imaging, preservation methods, tissue evaluation, and surgical procedures. We need to attend conferences, workshops, and webinars related to eye banking and collaborate with experts in the field to exchange knowledge and experiences. I feel attending the conferences and workshops for the eye bankers is very, very important. But if we look at the presence of them in any conference, it's only the Eye Bank Association of India's conference in India, where we will see the actual eye bankers coming and presenting and learning from each other. Otherwise, there are not many opportunities for them to learn, especially for the managers, technicians, and the recovery and the counselors. So I think as a group we can work on having more smaller workshops, even on online, virtually, where we can increase their attendance. Collaborate with the research institutions and industry. Normally, when we talk about research and collaboration with the industry, we will only look at bigger eye banks. It's LV Prasad or Arvind or other AIMS, etc., who collaborate and do the research. We also need to look at, like when we're talking about septicemia, a larger sample size. We need to work together as an iBank fraternity to do these kind of research and collaborate with the research institutions. We need to create partnership with the research institutions, universities for cutting edge research. Just an example for the iBank Society of Rajasthan, they have collaborated with the IHMR, Indian Institute of Health Management and Research, to do a study to find out how many corneal blind patients are in Rajasthan. So they are doing a similar. We can have similar kind of studies at different states as well. Industry leaders to gain access to new product development. So we all need to, as an eye banker, corneal surgeons, need to be in touch with the industry leaders, because we have somehow our very own specific requirement. Even how to make a tray which is easy to carry in the recovery technician kit, we can actually work with the industry people and have them custom made for us. And this is done at the individual level many of the time, but not as a group. Stay involved in the clinical trials and studies that evaluate the efficacy of the new technologies and treatments. So that is very, very important. Talking about the new innovations and research, currently there's an organization named Black Frog Technologies. They created a very small refrigerator for to carry the vaccine from one place to another. So somehow we met them at Mangalore, and it's a Mangalore-based organization. And then we thought it's a good idea if we can have similar kind of setup for to carry the tissues from one place to another. And we are doing at Dr. Shroff Charity Eye Hospital, we are doing a study with them to test the efficacy of the small refrigerator, that what is the temperature in the ice box, what's the temperature in that machine, how efficient it is. So we have started the study in April, and we will be looking at many of the sample sizes to see that how efficient that is. And if we feel that that's efficient, then we will definitely come to EBI to see that how can we promote and we can use them at a larger level. Continuous professional development. So training is the key word for the iBankers. More and more trainings. So we need to encourage the iBanking staff to engage in continuous professional development to enhance their knowledge and skills. We need to offer them training programs, workshops, certifications related to new technologies, quality assurance, regulatory compliances, and best practices in iBanking, and provide opportunities for the staff to attend relevant conferences and seminars to stay updated. Regarding the certification, I again feel that's a very large gap in our system, where we don't have a certification system for the recovery technicians, eye donation counselors, evaluation technicians. What is done is more at an individual level. If we look at iBank Association of America, they have this certification named CEBT, Certified iBank Technician. And it is such a reputed certificate for them that they carry it on their sleeve. They will write it as a degree in their every presentation, every paper. You will find that CEBT written there. It's that prestigious, and they have to renew it every year. Like they have to go through the annual competency and again renew it. So maybe iBank Association of India can start a similar certification process, especially for the recovery technicians and evaluation technicians, because the graph depends on the type of tissue which they are getting and how they are getting. So that is something which we definitely as a group need to look into. Quality assurance and standardizations. We need to implement the quality assurance programs and adhere to established standards and guidelines, especially by the guidelines of National Program for Control of Blindness. We need to regularly review and update protocols and procedures to incorporate advancements in technology and best practices. And we need to also ensure that the staff is trained and they follow the standardized protocols to maintain consistent quality. Maintaining the quality and training of staff is important, because once I was having a conversation with two of the technicians and they said, "Ma'am, हम तो 2 मिनट में कॉर्निया निकाल लेते हैं." So they were taking it more as like कि मैं कितना process fast करता हूँ. I said, no, it's not about how fast you can take it. How clean, how aseptically you can take is more important. So every step which is written in the SOP needs to be followed. If it's 15 minutes, 20 minutes, your efficiency or your performance is not the minutes in which you take it out. It's how aseptically you take it out, how properly you take it out. So I think this needs to be also like inculcated in our technicians, that we need to do it in a more proper manner. Networking and knowledge sharing. We need to foster a culture of networking and knowledge sharing within the iBanking community. Currently, we are at a stage where there's a lot of knowledge within the group itself. If we look at the Indian iBanking, if we look at the top 10 iBanks or top 20 iBanks, there's a lot of knowledge present there. And then there are areas where there is no knowledge. If you go to Northeast, there is no iBank, there is no training programs available there. So we as a group need to foster that how can we collaborate together and learn from each other instead of like waiting for some foreign agency to come and train us now. I think we have enough knowledge that we can train Africa, we can train Bangladesh, we can train Nepal, everywhere. Engage with the other iBanks, transplant organizations, and professional societies. It is also very important that we also see that how can we collaborate with organ donation organizations like Mohan Foundation, Orbo, and I'm pretty sure Soto, Roto, etc. How can we start the dialogue with them and then continue working with them? Participate in collaborative initiatives and committees focused on advancing iBanking practices and technology. There's a huge gap which was earlier and still remains there. So in southern part of the country, we do have two large iBanks, LV Prasad Eye Institute and Arvind Eye Institute. And they are big training centers, but they are in the southern part of the country. In northern part of the country, there was no training center available. And people were facing the issue of like travel, etc. So, and of course, the other gap is the implementation of the quality protocols, and proper orientation and trainings are required for that. In year 2021, at Dr. Shroff Charity Eye Hospital, they started a Jagat Singh Eye Bank Training Academy. It's a first formal eye bank training academy in the northern part of the country. It's in Delhi to provide world-class training to strengthen eye banking in our country and to be a partner of choice for eye bankers seeking opportunities to learn new skills. Why the name Jagat Singh? Jagat Singh was a counselor who started working with the Dr. Shroff Charity Eye Hospital when he was an 18-year-old guy. And he was the counselor who trained many of the counselors in Delhi. He also trained me to be the counselor. Yes, sir? Yeah. So that, and he passed away in 2020. And we thought, there is no other way by which we can pay tribute to him, so that academy is by his name. This academy is a one-stop solution for all iBanking training needs, where a lot of technologies is used, virtual training programs, webinars, etc. If you look at the iBank we all know that these activities: public awareness, tissue harvesting, distribution, evaluation, preservation, quality assurance, and pre-cut tissue preparation. All these needs different kind of training. There is no like one solution for everyone. So there are different training programs for every place. Training programs which are required in the iBanking are the iBank technician, the counselor, corneal evaluation technician, iBank manager, amniotic membrane preparation, corneal transplant coordinator. I have recently added this corneal transplant coordinator here because if we look at the NABH guideline, they have this specific requirement to have a trained corneal transplant coordinator who is dealing with the recipients. And they need to have a formal training certificate with them. So there are no training institutes or training certification available for these, but this is an NABH requirement. So it's more or less done internally right now with the institutes where NABH is happening. Technology for training. So in COVID, we have learned how can you go for virtual meetings, online workshops, distance learning. We can have hybrid curriculum, online, wet labs, and in-person training modules as well. Especially after the COVID, even the World iBanking Symposium, the GAIBA, the iBank Association of America, all went online. And it was a fantastic opportunity for every one of us to go attend those programs, submit our abstract as well. So many of the people even presented there. So I think going more into using the technology for the trainings and for presentations and making our presence felt at the international forum is very important. Of course, training is about doing the right things the right way. Training is also about training the staff on SOPs, quality documentation practices, and it's not a one-time event. We have to go for trainings, more trainings, refresher trainings, and again trainings. Tissue harvesting is very, very essential. So I say an experienced recovery technician also needs to go for an annual competency review, annual competency assessment every year. and they need to be certified by either iBank Association of India or a panel of experts which say that, okay, this person has gone through the annual competency assessment. These are some of the workshop glimpses here, recovery technicians. This was by the EBI where we were working on to standardize the recovery processes. Train the Trainer program. This was for the first time was initiated at the Bangalore EBI conference and got a huge response from the medical directors, iBank managers, and the senior recovery technicians, where they were specifically trained how to use a published Reaper tool to evaluate the performance of the iBank recovery technicians. These are again some of the photographs of the ERT training workshops, evaluation technician training, pre-cut procedure trainings. Amniotic membrane is another buzzword in the field of iBanking now because everyone asks for the amniotic membrane, but only I think LV Prasad and few other iBanks provide the amniotic membrane currently. The future of the iBanking. I would say that digital iBanking is the future. With advancing technology, we can provide better training, faster processing, higher quality corneal tissues for transplant. And it's not that we use technology, we live the technology these days. So we can't shy away from using technology at all level of iBanking, started from the counselor to the medical director and the corneal surgeons. Thank you for giving me the opportunity to present today. And I would like to thank Dr. Manisha Acharya and Mr. Surinder Dikshit, who supported me with preparing this PPT, as well as they also run the JS iBank Training Academy. Thank you so much.
Thanks, Rakhi.
Thank you, Rakhi. Rakhi, how this training academy that you've started, it's open to you're training people mainly in North India, or you made
No,
an,
sir, we are open
module?
we have modules. We have all the modules available with us. So basically, a lot of work was done before launching the academy. So we have modules for counselor, technicians, evaluation technicians, even the medical directors. Till now, we have trained from 2021 68 candidates from all across the country. We have trained one candidate from Meghalaya as well as a recovery technician. One from the medical director of Ethiopia iBank is trained here. And we are currently in training Nepal, the AMG preparation at Nepal iBank. The person is trained here. So it's open for everyone who can understand Hindi and English.
So that again, I think should be on the EBI website so that more people can take advantage
Sure,
of
sir.
this training,
Sure.
because I'm sure yours is a not-for-profit. So
Yes, sir. So there is a nominal fee,
Yeah,
but
fair enough, yeah.
but if the iBank is in a
no, the iBank can
yes.
sponsor it.
Yeah,
The
iBank is
local
sponsoring
can
it.
send
Local
that.
iBank sponsor.
The fee doesn't matter, but just the fact that it's there so that more people can be made aware
Sure.
of this, because it's something unique. And we used to train from our iBank when we were affiliated with IFTB. IFTB would send people from many of the African countries to our iBank to train people, but then we had an IFTB protocol. Now IFTB is dead. So something like this is local, we can use
Sure,
this. Yeah.
sure, sir. Will do.
Okay.
Thank you so much. Thank you.